South Africa is deep in the winter of the COVID-19 pandemic. Until July, the Western Cape was weathering the worst of the pandemic in terms of infections and deaths. But now, Gauteng is in the eye of the storm, with the Eastern Cape and KwaZulu-Natal rapidly becoming the new epicenters.
Where Gauteng is now is where we were 4 or 5 weeks ago, or even 6 weeks ago. So they might still have a very steep incline for the next 6 weeks, and it will be quite devastating if that's what's happening in their setting.
The Western Cape was the first province to report COVID-related fatalities, with the deaths of 2 people on the 27th of March. That was the first day of the national lockdown. The trajectory of infections and mortality rates was still relatively slow, with 4 deaths reported in the province. One of the fatalities was Nurse Petronella Benjamin, a devoted nurse with 40 years of service and known to colleagues and patients alike as Aunt Nellie. Nurse Benjamin had the tragic distinction of being the first healthcare worker in the Western Cape to succumb to the virus.
Nellie loved her calling. She was born to purpose. She was absolutely born to do what she did. And her whole life was what she did, you know. She was a people's person. She just reached out to everybody, and everybody was her family.
For years, her family had been urging her to retire.
She would always tell me, Rudy, I've just got so much still to do. I was begging her already from the beginning of the year and pestering her already and said, Nelly, when? And she never gave me a date. And then, you know, I think it was in February month when she said, Rudy, I've set my date. It's actually now the 30th of April will be my last day of active work as a professional nurse in the nursing field.
Aunt Nellie died on the 29th of April, a day before she was due to retire and begin her golden years. Over the next 2 months, the virus would exert its deadly chokehold over the Western Cape. By the 23rd of May, there were 276 deaths. At the end of that month, the figure had doubled. By the 13th of June, the Western Cape had recorded a total of 39,159 confirmed COVID-19 cases, representing nearly 70% of all cases countrywide, with 1,008 COVID-19 related deaths. By June the 23rd, there were 1,500 deaths. The province was struggling to cope with the speed and intensity of the surge.
The big thing that shocked us was while we were planning for it, when it hit us, it hit you fast. Yeah. The acceleration is the thing that we learned the most about.
Since then, valuable lessons have also been learned about who is more susceptible to contracting and dying from the virus. The Provincial Department of Health says a quarter of the patients analysed had 3 or more underlying conditions or comorbidities. Diabetes and hypertension are the most common underlying conditions. HIV, AIDS and tuberculosis are also risk factors, but to a lesser extent.
We had a big data system, and then also from the outset we were very meticulous about saying that we're not going to miss any possible death that could be related to COVID.
But how prepared is the rest of the country with its ailing, under-resourced healthcare system and social environment where prevention measures against the deadly virus have failed?
Not a single person, doesn't matter who they are, could have predicted the personal impact that COVID would have had on every single person. We together now need to go into the space where communities take COVID seriously.
For the loved ones of Nurse Petronella Benjamin and the thousands of South Africans who have died, the devastating consequences of COVID-19 will last a lifetime. Hazel Friedman, SABC News, Cape Town.